Welcome back to the KenkoVibe podcast, everyone. I'm Ethan Reed.
And I'm Grace Morgan.
And today we're tackling a topic that might be a little bit delicate.
Yeah.
Peyronie's disease.
It is.
A condition that affects the penis, and we're going to dive deep into it today. So.
Yeah, it's something that we definitely need to be more open about talking about.
Absolutely.
Peyronie's disease is basically a buildup of scar tissue inside the penis. We call that plaque.
Okay.
And that plaque isn't as flexible as normal tissue is, so it can cause bending or curving of the penis during an erection.
Now, before anyone freaks out,
Right.
not every curve is a sign of Peyronie's.
Right. A slight curve is totally normal for lots of men. But when we're talking about Peyronie's, we're talking more of a pronounced bend.
Gotcha. So how common is this?
You know, it's actually more common than you might think.
Really?
Studies have shown that about 6 to 10% of men between 40 and 70 have Peyronie's disease, and that's probably just the tip of the iceberg.
Oh, wow.
Because so many men are embarrassed or hesitant to actually talk about it or seek help.
So it's probably underreported.
Yeah, definitely.
Wow, that's a significant number of the male population.
It is.
So let's talk symptoms now.
Sure.
We know that a curved penis is a key indicator.
Yeah.
But are there any other red flags that men should be aware of?
Yeah. So while a curve is often the most noticeable symptom, it's not the only one.
Okay.
Men with Peyronie's, they might also experience some pain, especially during erections.
Okay.
And they might feel lumps or hard spots in the shaft of the penis.
Okay.
And it can lead to difficulty with sex.
So the symptoms can vary a lot from person to person then?
Absolutely.
Now, what causes this?
That's the tricky part.
Okay.
The exact cause of Peyronie's disease isn't always clear.
Right.
But one of the leading theories is that it can be triggered by injury to the penis when it's erect.
So like bending it too far during sex?
Yeah, exactly. But the interesting part is that a lot of men with Peyronie's don't even remember a specific injury. Studies have shown that up to 80% of men can't pinpoint an exact event.
So if it's not always from an injury, what else could be contributing to this?
Well, that's what researchers are trying to figure out.
Right.
There's growing evidence that genetics could play a role.
Okay.
So if your father or brother has Peyronie's, you might have a higher chance of developing it too.
That makes sense. Family history is a big part of a lot of health conditions.
Exactly.
So we've got possible injury and genetics playing a role. But what other risk factors are there? Is it mostly older men?
Age is definitely a factor.
Okay.
The most commonly diagnosed are between 40 and 70.
Right.
But it's not just about age.
Okay.
There's some other interesting connections that research is exploring.
Like what?
Well, one is a link between Peyronie's and connective tissue disorders.
That's not something I would have expected.
All right.
Can you elaborate on that a little bit?
Sure. So, conditions like Dupuytren's contracture, where your fingers bend inward, or plantar fasciitis, that pain in your heel. These disorders point to a connection between how our bodies form and repair connective tissue and this Peyronie's development.
So it's not just about the penis itself. It could be about
Yeah.
how the body handles connective tissue overall.
Exactly. And there's even more men with erectile dysfunction, especially if it's related to diabetes,
Okay.
are at a higher risk for developing Peyronie's.
That's interesting because we're talking about how Peyronie's can lead to erectile dysfunction. So it's like a
vicious cycle.
Yeah.
Yeah, and just to kind of complete the picture here, we should also mention that prostate cancer surgery and certain autoimmune diseases can also increase a man's risk.
Wow. This is a lot more complex than I thought at first.
Yeah.
So we've got a good understanding now of what Peyronie's is, symptoms, potential causes, and risk factors.
Yeah.
How is it diagnosed, though?
So it's actually pretty straightforward. It usually just involves a physical exam.
Okay.
Where the doctor will examine the penis feel for any plaques or hard spots and assess the degree of curvature.
So just a hands-on examination and discussion of your symptoms.
Pretty much. In some cases, they might recommend an ultrasound to get a clearer picture of the scar tissue and where it is.
Okay.
But it's really a pretty simple diagnostic process.
Okay. Good to know that it's not as daunting as I thought it would be.
Right.
So let's talk treatment.
Sure.
What can be done for men who have been diagnosed with this? Is it something that can be cured or at least managed?
Well, there is a little glimmer of hope.
Okay.
In some mild cases, Peyronie's might actually resolve on its own.
Really?
Without any intervention.
Oh.
But I gotta be honest, that's not usually what happens.
Okay.
Most men will probably require some form of treatment
Okay.
to address their symptoms and improve their quality of life.
So while spontaneous resolution is possible, it's not something to bank on.
No.
So what are the treatment options then? Is there like a one-size-fits-all?
I wish, unfortunately, there isn't a magic bullet for Peyronie's.
Right.
The best treatment really depends on how severe it is, the specific symptoms that the man is experiencing, and his personal preferences.
So what are some of the treatments that doctors might recommend?
Well, one option that's gaining a lot of traction
Okay.
is traction therapy.
Okay, I've heard of this.
Yeah.
What is that?
It involves using a device that gently stretches the penis over time, which can potentially reduce that curvature and even help restore some length.
Okay.
It's non-invasive.
Good.
And can be pretty effective for some men.
So it's like physical therapy for the penis.
Yeah, exactly. And because it's non-invasive,
Right.
it's often a preferred first-line treatment, especially for men in the acute phase of Peyronie's when that plaque is still forming.
Okay.
And the condition is more likely to progress.
So traction therapy, good option for the initial stage.
Yeah.
What about medications? Are there any drugs that can help with Peyronie's?
Yeah, there are. We have both oral medications and injectable medications.
And do these aim to, like, completely straighten the penis?
Well, they can help to reduce that curvature and improve symptoms.
Okay.
Some work by breaking down the collagen in the plaque, making it more flexible,
Okay.
while others work on reducing inflammation and pain.
Okay.
But complete straightening isn't always a guarantee.
So medications can be part of the treatment plan,
Yes.
but not a guaranteed fix.
Right.
Now, what about surgery? Is that ever considered?
So surgery is typically reserved for more severe cases
Okay.
where other treatments haven't been successful or when the curvature is so bad that it prevents sex.
Right.
There are a variety of surgical techniques.
Okay.
Some aim to shorten the unaffected side of the penis to kind of match the curve, others at lengthening the side with the scar tissue. And then there's always the option of a penile implant,
Right.
which can help men achieve an erection regardless of that curvature.
So it's more of a last resort, but a viable option.
Exactly.
You know, we've talked a lot about the physical aspects of this,
Yeah.
but it's important to acknowledge the emotional and psychological impact this can have on men as well.
Absolutely.
It's not just about the changes to the body. It's about how those changes can affect a man's self-esteem,
Yeah.
body image,
Our relationships.
their relationships, their whole life.
Definitely.
This can be a very emotionally charged condition
It can.
that changes the pain,
Yeah.
the difficulties with sex. All of that can lead to feelings of embarrassment, anxiety, shame.
Yeah.
And that can really take a toll on a man's mental health and his relationships.
Absolutely.
It can be very isolating for men going through this.
It can.
So what are some things that they can do to cope with these emotional and psychological challenges?
Well, first of all, just remember that you're not alone.
Yeah.
Peyronie's is more common than you think, and there are other people out there who understand
Right.
what you're going through.
Yeah, that makes a big difference.
It does. Well, one of the most important things is to be open with your partner.
Communication is always key
Always.
in any relationship,
Both
but
of your-
especially with something like this.
Especially something as sensitive as this.
Yes.
Let your partner know how you're feeling physically and emotionally.
Right.
And remember, it affects both of you.
That does.
So be open to their perspective.
It's shared experience.
It is.
What about professional help? Is that something that you would recommend?
Absolutely.
Right.
A therapist or a counselor can provide a safe space
Yeah.
to process those emotions, work through your anxieties, and develop those coping mechanisms.
Right.
You know, they can also help you and your partner navigate the challenges of intimacy and communication.
So it's about taking care of your mental health as well.
Absolutely. Peyronie's is a multifaceted condition.
Right.
Addressing all aspects of it is crucial.
Okay, so we've unpacked the basics of Peyronie's,
We have.
from the causes, the symptoms, to the treatment options.
Yeah. But there's a lot more to explore, especially when it comes to the latest research and advancements in the field.
Well, let's take a quick break and we'll come back and we'll delve into those after the break.
Sounds good.
Okay, so we're back
We are.
and ready to dive deeper into this.
Yes.
Before the break, we were exploring the possible causes, the range of symptoms, and even touched a bit on the emotional impact this can have.
Right.
But now I'm really curious about the research side of this.
Sure.
Are there any promising new treatments or approaches on the horizon for Peyronie's?
You know, there's always something new happening in medical research,
Right.
and Peyronie's is no exception.
Okay.
Scientists are working hard to find more effective and less invasive ways
Yeah.
to help men manage this condition.
Good.
So one area that's really generating a lot of buzz is the development of new medications.
So beyond what we've already talked about,
Yeah.
are there any new drugs coming out that look promising?
There are a few promising candidates that are actually in clinical trials right now. Oh, wow.
Some of these medications target specific pathways that are involved in that scar tissue formation.
Okay.
So they're aiming to either slow it down or even reverse that process.
Oh, wow.
And others are focusing on improving blood flow to the penis,
Okay.
which could help to reduce that plaque buildup and improve erectile function.
That's good. So what about non-pharmaceutical approaches, though?
Right.
Are there any advancements in things like traction therapy or other non-invasive techniques?
Absolutely. So researchers are constantly refining treatments like traction therapy,
Okay.
making those devices more comfortable,
Right.
more user-friendly.
That makes sense.
And they're also exploring new ways to deliver targeted therapies directly to that plaque.
Okay.
So using things like ultrasound
Oh.
or shockwave therapy.
Wow.
These methods would aim to break down the scar tissue without needing surgery.
So it seems like there's a lot of effort being put into finding ways to treat this without resorting to surgery.
Yeah, definitely.
Yeah.
It's a big focus.
Now, shifting gears a little bit. Sure. What about lifestyle changes?
Mm-hmm.
Are there things that men can do day to day that might help manage their condition or maybe even improve symptoms?
That's a great question, and it's one that comes up a lot.
Yeah.
You know, while lifestyle changes alone won't cure Peyronie's,
Right.
certain habits can definitely contribute to overall health
Right.
and well-being, which is so essential when you're dealing with any condition.
So you're talking about healthy diet, regular exercise, stress management, that kind of thing.
Exactly.
Right.
Eating a balanced diet, lots of fruits, veggies, whole grains, that gives your body the nutrients it needs to repair and maintain healthy tissue.
Right.
And then regular exercise improves cardiovascular health,
Oh.
which is so important for erectile function.
Right.
It also helps reduce stress and improve your mood.
So it's really a holistic approach that's key here.
It is.
You've got to address both the physical and the mental side of this.
Yeah, and speaking of that mental aspect,
Right.
you know, it's important to acknowledge that emotional toll.
We already talked about communicating with your partner.
Right.
But I want to emphasize again that seeking professional help from a therapist or counselor can be so beneficial.
Yeah, having that safe space
Yes.
to process emotions, work through anxiety.
Yes.
All of that.
And it's not just about individual therapy. You know, couples counseling can also be really helpful
Okay.
to navigate those relationship challenges that can come with this.
It's a team effort.
It is.
You know, I think it's also important to talk about some of the myths and misconceptions that are out there.
Oh, yeah, definitely.
I'm sure you've heard a lot in your practice.
I have.
So what are some of the most common ones that you come across?
Well, one of the biggest is that Peyronie's is a sexually transmitted infection.
Really?
Yeah. Which is absolutely not true.
Okay, so you can't catch it from somebody.
No, you can't.
Okay, good to know.
It's not contagious.
Right.
Another common one is that Peyronie's will always get worse over time,
Okay.
leading to severe curvature and erectile dysfunction.
Right.
And while it's true that it can progress in some cases,
Yeah.
it often stabilizes.
Oh.
And the symptoms might actually improve without treatment.
So it's not a downward spiral?
No,
Okay, good.
it can really vary.
It varies.
Yeah, from person to person.
That makes sense.
So that's why it's so important to talk to your doctor about
Yeah.
your individual symptoms and concerns so they can help you figure out the best treatment options.
So personalized care is really important.
Absolutely.
Okay. What other misconceptions are out there that you think are important to debunk?
I often hear men say that Peyronie's is just a sign of aging
Right.
and there's nothing you can do about it.
Hmm.
And while age is a risk factor,
Right.
it's not a death sentence for your sex life.
Okay, good.
There are so many treatment options available,
Right.
and men can manage this condition
Yeah.
and maintain a fulfilling sex life.
So don't just accept it.
Right.
Be proactive. Seek help, explore the options. Okay, now I think another big one, and we've touched on this, but surgery is the only effective treatment.
Right. A lot of people think that.
Yeah.
And that's not true.
Okay.
While surgery can be an option,
Uh-huh.
it's not always necessary.
Okay.
Like we talked about, those non-invasive treatments.
Right.
Traction therapy medications can be very effective,
Especially early on.
especially in those early stages.
Okay.
So it's all about weighing those risks and benefits
Right.
of each option and choosing what's right for you.
With your doctor, of course.
Of course.
You know, I think one other thing that's really important is that there's no shame in having Peyronie's disease.
Absolutely.
It's a medical condition, just like anything else.
Right.
Nothing to be embarrassed about.
Exactly. And I think that ties back to the importance of being open
Yes.
and having that support.
Yes.
If you're struggling with this, talk to your partner, your doctor, a therapist.
Yeah.
Building that support system is essential.
So we've covered a lot of ground today. We've gone through the complexities of Peyronie's disease.
Yeah.
From the potential causes, symptoms, to the latest research, importance of seeking support.
Absolutely.
It's a condition that can impact a man's life significantly.
It can.
But with the right information and resources.
Yeah.
It doesn't have to define you.
Exactly. And I think it's really important to reiterate that knowledge is power.
Yes.
The more you understand about this, the better equipped you are to make good decisions.
Absolutely.
About your health and well-being.
Be informed.
Yeah. Keep learning, ask questions, and advocate for yourself.
And remember, you're not alone.
Absolutely not.
There are so many others out there who understand what you're going through.
Right.
And there's a lot of support and resources out there.
There are.
To help you navigate this. We're back for the final part of our deep dive on Peyronie's disease.
Yeah.
We've talked about the science behind it and how it can affect a man's life. But now I think it's important to shift our focus to the bigger picture.
Yeah, I agree, living well with Peyronie's disease.
Exactly.
Because it's not just about managing symptoms.
Right.
It's about thriving despite the challenges.
Absolutely. It's about, reclaiming your life, your relationships, your sense of self, even with this condition. So what advice would you have for men who are on that journey?
I always tell my patients that knowledge is power. The more you understand about Peyronie's, the better equipped you'll be to make informed decisions about your health.
Right. Be proactive, be informed.
Exactly. And beyond knowledge, building a strong support system is essential.
Yeah.
Talk to your partner and talk to your doctor, talk to a therapist, share your feelings and experiences with people you trust.
It's so important to have those people in your corner.
It is.
Who understand what you're going through.
Absolutely. And there are also tons of online communities and support groups specifically for men with Peyronie's.
That's great.
So, those platforms can give you a sense of camaraderie, shared experiences, and even practical advice from other men who have been there.
It's that sense of community, knowing you're not alone.
Exactly. And I think it's also important to focus on what you can control.
Yeah.
You might not be able to change the fact that you have Peyronie's.
Right.
But you can make choices that support your overall health and well-being.
Right. Taking care of yourself.
Yeah. Eating healthy, exercising, managing stress, getting enough sleep. All of those things can have a positive impact.
It's that holistic approach again. Now, what about intimacy and relationships?
Yeah.
How can men with Peyronie's maintain a healthy and fulfilling sex life?
Open communication is key.
It always is.
Always talk to your partner.
Yeah.
About your concerns, your fears, your desires. Experiment with different positions.
Okay.
Explore other ways to be intimate. And don't be afraid to see a sex therapist.
Yeah, a professional can always help.
Absolutely. It's about finding what works for you as a couple and redefining intimacy.
As we wrap up, I want to leave our listeners with a message of hope.
Yes.
And resilience. While this condition can be challenging, it doesn't have to define you.
Absolutely.
With the right mindset, support, and treatment, you can live a full and fulfilling life.
I completely agree. Don't let Peyronie's steal your joy.
Yeah.
Or your sense of self. Embrace this journey. Find the resources you need.
Yeah.
And never stop advocating for your health and happiness.
This has been such a great conversation. Grace, thank you so much for sharing your expertise with us today.
My pleasure, Ethan. I'm always happy to talk about this and empower men with the information they need.
And to our listeners, we hope this deep dive has been helpful and informative. And if you are struggling with Peyronie's disease, please remember that you're not alone.
You're not.
Reach out to your doctor, connect with a support group, and remember, knowledge and self-care are powerful tools.
This is Grace Morgan.
And I'm Ethan Reed, signing off for the KenkoVibe podcast. Don't forget to subscribe, like, comment, and share this episode with anyone who might benefit from this information. Until next time, take care and stay healthy.